So back pain and chronic pain afflict many Americans and many people throughout the world. Millions of people are affected regularly with these ailments, specifically back and neck pain.
The causes are generally unknown. They can be multifaceted. It's estimated that approximately 60 to 70% of the population in industrialized countries has back pain at some point in their lives.
People with chronic back pain consume a lot of healthcare dollars. So one reason to have a comprehensive program is to try to be more cost effective and not duplicate services and try to really only do what's needed.
We're here to help people get the treatment they need in the most effective and most expedient way.
I'm Farhan Kareem. I'm an orthopedic spine surgeon with Starling Physicians.
I'm Dr. Kathleen Abbott. I'm a physiatrist, which is a physician of physical medicine and rehabilitation.
My name is Dr. Kayvon Elizadeh. I'm an interventional pain physician at Starling Physicians. Our goal at Starling Physicians and our spine and pain center is to alleviate the stress on providers and patients together in getting to see the appropriate provider for their pain ailments and their spine pathology and ailments. We have accomplished this by allowing patients and providers a single phone number and single intake provider who will assess the patient's initial symptoms and refer that patient to the appropriate provider, whether it be physiatry, chronic pain management, interventional pain management, as well as, if need be, spine surgery.
We were looking to provide a surgical solution for patients, but a comprehensive solution for patients, whether it be physical therapy, physiatry, medication management, injections, and surgery as a last resort. We want to ensure patients that we're here for them in all aspects of their spine care, whether it's a simple back sprain to severe spinal stenosis requiring surgical intervention.
In order for us to obtain an appropriate diagnosis for each ailment and symptom, this requires a thorough history and physical examination and intake form that assesses not only the patient's symptoms, but also their previous medical history, social history, medication list, and even more than that. So once we have that established tentative diagnosis, then we can assess each patient and proceed further with the appropriate advanced imaging, again, to confirm or refute that diagnosis and base our treatment on that diagnosis specifically.
So physiatrist is a physician of physical medicine and rehabilitation. And the primary goal of our practice is to try to improve patients' function and quality of life. So we do that by trying to reduce pain level, improve ability to do activities of daily living, walking, basic daily activities. And so some ways we do that is to evaluate the whole person and try to look at sleep quality, medications if needed, look at their functional activity and our exercises needed. I see patients with spinal pain anywhere from the occiput to the coccyx. We evaluate for doing injections, X-ray or MRI might be done. Treatments include trigger point injections, that'd be into the muscles. Could be cervical, thoracic. I've done them in the lower extremities, upper extremities. Spinal injections under X-ray guidance or fluoroscopic guidance. That'd be for cervical facet joint, thoracic facet, or lumbar facet joint injections. That may be for patients who have chronic pain from those areas, from arthritis or old prior injuries like a car accident. Also, we do the epidural steroid injections to help with nerve pain from disc herniation or from lumbar spinal stenosis. I do the sacroiliac joint injections. That'd be mainly for patients who have pain in the buttock region, and that travels into the lower extremity as well. And we do the hip joint injections for anybody with osteoarthritis. That's under our X-ray guidance or fluoroscopic guidance as well.
There are a variety of interventional non-surgical minimally invasive procedures that I provide for patients, most of which involves back, neck, and joint pain. Those involve direct cervical epidural, thoracic and lumbar epidural, which are low back injections of steroid for back and neck pain. We here at Starling Physicians and myself are performing more cutting edge advanced interventional non-surgical procedures, which do involve both high frequency stimulation, spinal cord stimulation for both failed back surgery syndrome, but also mechanical back pain. And in addition to that, we were also performing geniculate radiofrequency ablation for knee pain, as well as chronic knee pain syndrome after knee replacement surgery.
The most common conditions we see include disc herniations of the lower lumbar spine as well as the neck. These disc herniation often result in symptoms due to pinched nerves. These pinched nerves often require decompression with surgery. The surgeries we perform include things as simple as a routine discectomy, which means removing the pressure on a nerve root from a disc herniation, to complex fusions for spinal instability. I also have special training in spinal trauma as well as spinal tumor surgery. Additionally, we also perform surgery for spinal stenosis, and as well as certain back conditions that may involve unstable segments of the spine. All surgery, we make sure to exhaust conservative management prior to performing surgery. I think that's very vital for patients to understand. As with any team-based approach to a care model, I think it's important that there's camaraderie between all of the colleagues. So myself, Dr. Abbott, and Dr. Elizade, we communicate at length regarding our patient care. We run imaging studies by one another. We speak to each other on the phone, all with the goal that the patient is getting the best possible care.
If I'm suspicious, maybe someone has rheumatoid arthritis or something along those lines, I can easily refer to rheumatology for a consultation. If somebody has severe osteoporosis and they're getting compression fractures, then it's nice to be able to refer to endocrinology to try to maximize treatment of osteoporosis. And anybody with vascular problems, heaviness in the legs, for example, it's been very easy to refer patients for a vascular evaluation to see if circulation is causing the symptoms in the lower extremities, and maybe it's not spinal stenosis that we think.
This allows the patient to have a broad range of treatment plans and options versus simply seeing one provider, such as a spine surgeon or even a pain physician. We use medications to help patients reduce their pain and improve their quality of life. We at Starling Physicians like to promote the non-opioid based medications, and there are multiple different types of medications that are non-opioid based that can help with chronic pain. The primary role of medication management in our multimodal approach involves non-opioid based medications initially. There are times, however, that a limited use of opiates do help preserve patients' daily function, quality of life, and pain reduction. And we make that assessment on an individual patient basis.
I think Starling Physicians is very well positioned to help people with chronic spine pain. We have a large geographical area to treat patients, all the way down from Southington, all the way up to Enfield, that's the Mass border, and the greater Hartford area.
The Hartford metro region is very advanced in terms of the technology we have to offer patients at all of our hospitals. So we make sure to be well-versed on these technologies and have the capabilities to use them for patients. I currently perform most of my surgeries at the Hartford Hospital Bone and Joint Institute, in addition to the Connecticut Spine Center at St. Francis Hospital and Medical Center, along with other leading local institutions and surgical centers.
We have on-staff physical therapists here that are readily available to help patients with whatever ailments that they are suffering from. We also have a broad range of radiological tools to use here in Starling Physicians. All of these modalities will allow us to assess patients in an expedient fashion and get those results and relay those results to the patients to help them come up with an appropriate treatment plan.
The beauty about having a spine center model is understanding too that some patients, whether it's due to comorbidities or other circumstances, may not be candidates for spinal surgery. And that's very important to realize. And those patients shouldn't their care should not be ignored. That's why we have the opportunity to treat them with alternative modalities, whether it be interventional pain management, new interventional techniques on the horizon, physiatry, trigger point injection. And that's one of the strongest benefits of the spine center model, is to basically understand and have patients as well as providers understand that we have alternative treatment modalities and we will find the best solutions for the patients. We're really tailored to what a patient needs.